For our GI module, I selected an article published in the New England Journal of Medicine, March 2021. Once weekly semaglutide in adults with overweight or obesity. Semaglutide is an approved medication for diabetes type 2, and it's a GLP-1 analog, and they are known to suppress glucagon secretion in the liver, stimulate insulin secretion in the pancreas, and slow gastric emptying. In addition, they impact the brain by decreasing appetite, thus decreasing intake, weight loss, and there is a benefit of increased insulin sensitivity because of the weight loss. The first step is a part of a 5-step trial design. So at the same time that this study was being conducted, 4 other studies were conducted. It was done internationally in over 16 countries, and the sample size collectively was over 3,000 participants. For step 1, they looked at patients without diabetes type 2, and this study was powered per power analysis at 99%. The study design was a double-blind, placebo-controlled, randomized trial with 2-to-1 intervention for semaglutide treatment versus placebo. Semaglutide was administered as an adjuvant along with lifestyle intervention, including counseling, reduced calorie diet, and predetermined exercise plan. Participants in the study were over 18 with a failed dietary effort to lose weight and a BMI of 30 or more or 27 or more with unmanaged weight conditions such as hypertension or PCOS. Unfortunately, this study did not look at long-term effects of the medication in terms of safety, but it did certainly identify the efficacy of this medication with this highly powered study group, which was over 1,900 participants. The co-primary endpoints that they were looking for in the results was weight loss at 5% or greater. And in the upper figure, you can see that the placebo group achieved just over 2% weight loss with a little bit of an uptick by the end of the study. And the treatment group achieved a 16% weight loss. And it was dramatic after the initiation and titration of the semaglutide treatment. The first graph is the observed in-trial data, and then the one to the right there is body weight change for the people who were able to maintain on treatment and didn't require rescue. And they actually achieved almost 18% weight loss, and the placebo group had about the same 2% weight loss over the 68 weeks. There were statistically significant results measured in the area of waist circumference, decreased systolic blood pressure, decreased hemoglobin A1C, improved physical functioning, and quality of life. So overall, the results were pretty tremendous. And one of the results was that all patients who remained on treatment were able to achieve normal hemoglobin A1C values at the end of the study. Adverse effects were primarily gastrointestinal, and they were considered mild to moderate, including the usual GI effects of GLP-1 analogs. We know with GLP-1 analogs that acute pancreatitis and gallbladder disease are a potential problem because this medication has been approved for some time for the treatment at a lower dose of DM2. GLP-1 inhibitors also carry a serious warning for thyroid C cell tumors and certain endocrine tumors, so it should be prescribed judiciously. They certainly were unable to determine long-term safety results, and while the study group didn't report these serious effects, we need to be very leery and careful in considering this medication. Thank you for your help and your persistence staying with me. Have a great day.